COVID-19 is a monster that you cannot see, but you can feel it. The connectedness is so important, and we have to remember that COVID took that away from us on a daily basis. We have to figure out where we can put it back in. On the onset of COVID, we were challenged to change our daily practices when we were visiting patients. The biggest change was the quality impact in terms of not being able to be at the bedside. Because the virus was so new, we didn't know clinically how it was going to impact care providers. So they wanted minimal interaction in and out of the room with the patient. So obviously the nurses and the doctors and the respiratory therapists were the most important. So what we were challenged to do was to look at our daily practice in ministry and adapt. When the first COVID patient died in the ED, I found myself placing my hands on the glass. And it still causes me to tremor when I think about that. Because instinctually, the chaplain is at the bedside when a patient is dying and supporting not only the patient, but all the providers. And at that moment, I felt so helpless. And it occurred to me that we were on the brink of something that was so unprecedented. We were going to have to rethink every practice that we had. Our pastoral care director and the management of the hospital helped us to navigate that. Telechaplaincy became a big part of what we began to do. We began to minister to the patients' families, calling them on the phone because there were no visitors here in the hospital. So we became the extended family of the patients, and then we also became the extended family of the family. I would also make up little kits for patients, Catholic patients with a rosary, Christian patients a Bible, prayer cards, and put a handwritten note and actually make it like a Christmas package, especially around the holidays, and the nurses would take them in, and then I would be on the outside of the window and say, "Can I call you?" And they'd say, "Sure." Or I'd walk by and just give them a hug sometimes. It was just learning how to let them know that they were not alone.